okay. While baby's nice and calm and asleep, I'm just gonna sneak my stethoscope down in to count heart rate for 1 full minute, respiratory rate for 1 full minute. Then I'm gonna start at the head, check the fontanelles, and check all the suture lines. I'm gonna check the eyes for symmetry, take my pen light, shine it in each eye to check the red reflex. Check the ears for make sure they're in line with the eyes. Check behind the ears for skin tags while checking the skin cartilage and development. I'm gonna check the nose for patency, 1 nair at a time. I'm gonna check the hard and the soft palate while also checking the rooting reflex, checking for any Epstein's pearls or any other abnormalities. I'm then gonna check the clavicle for any crepitus. I'm gonna go down, check the brachial pulses. Go up to each hand, check all 5 fingers, no extra digits. Check the palmar creases, checking the grasp reflex. Okay, all while checking tone, color. And we're gonna open them up. Check the breast buds for development, symmetry, and counting the nipples. Looking and then listening to all areas of the heart, all areas of the lungs, and then you can sneak on the back and listen. Okay, making sure no signs of respiratory distress or retractions. I'm looking at the abdomen, then listening to all quadrants, and then palpating to all quadrants. Checking the umbilical cord, no redness, swelling, drainage, 2 arteries, 1 vein. Coming down, checking the femoral pulses, making sure the meatus is at the tip and not above or below. Palpating each testy 1 at a time, making sure they're distended and not swollen. I did note a little bit of meconium, so I do know that the anus is patent. Going down the legs, checking tone, color, warmth, checking the Babinski on each foot, checking the plantar grasp on each foot. I can count all 5 toes, no extras. I'm gonna grab the jaw with my thumb and my forefinger to make sure it's a good support while flipping them over. Making sure there's no fat pad in the back of the neck. Checking the spine all the way down, it's straight. There's no dimples, there's no hair tufts. There's none in the sacrum as well. I'm then going to pull while I have the diaper down or off. I can pull the legs, check to make sure that they're even and then that gluteal folds are symmetric. I'm gonna flip them back over. I'm gonna pull him up just a little bit to check for head lag. Once the head is rested back down, then let go of the hands to see if he does the Moro reflex. Last but not least, check his temperature. All right, and that's it. I missed